Hi, I'm Tamaria Mitchell. This is my week 8 lab video.
I'm Quentin Banks and I give her permission to record me.
Alright. I'm going to do a scan of the room so you guys see there's no scripts present. I'll do behind me too. Alrighty. Put this up and we will get this started. Cool. I'm performing hand hygiene, putting on my gloves, and providing my patient with privacy. Hello, Mr. Banks. How are you today?
Good. How are you?
I'm doing good. Thank you for asking. So before we get started, we'll confirm that this is the correct patient. So we'll have him state his name.
Quentin Banks.
And his birthday.
September 26, 2006.
Alright, that's correct. This is our patient. So, Mr. Banks, I'm Tamaria Mitchell. I'm a student nurse at Chamberlain University, and today I'll be doing a head-to-toe assessment on you. It'll take no more than 30 minutes, and we're just doing it to make sure that everything's functioning properly and that you're in good health. Will that be okay?
Yes.
Alright, so the first thing we'll do is assess our patient for any allergies.
No.
Alright, and then on a pain scale, 0 being no pain at all, 10 being the worst pain in your life, are you having any pain?
No.
Alrighty, good. Alright, so moving on. First thing we'll do is do general appearance. So off general inspection or appearance, we'll note that my patient's speech is clear, his mood is pleasant, as well as his facial expression is appropriate for the situation. And next we'll make sure that he is alert and oriented by having him state his name.
Quentin Banks.
Birthday.
September 26, 2006.
Current month.
November.
Where are we?
Home.
And who's the current president?
Biden switching out with Trump.
Or Trump switching out.
Oh,
Biden.
yeah.
Yeah, but yeah, he knows. He's in times 4. Alright, so next we'll move on to his skin, and we'll note that his skin color is appropriate to his ethnicity, and then we'll look anteriorly and posteriorly and look and note that he has no incision, lesions, or wounds of that sort, which is good. We'll take the backs of our hands and feel them and note that his skin is warm to the touch, so that's what we want. And then after that, we'll move down to his nails and assess his nails. His nail beds are round, they are pink, there's no clubbing present, and then his capillary refill is within the less than 2-second mark, which is good. That's what we want. So next we'll move, I'll stand on this side. Next we'll move to his head and we'll palpate it. Make sure there's no indentations or such, and then we'll also move to and look at within his hair, at his scalp, and note that there is no lesions or infestations, which is what we want. So that's good. Alright, so after that we'll move on and check some cranial nerves out. So I'm going to have you clench your teeth. Alright, and then close your eyes. Tell me when you feel something. You can unclench your teeth. Alright, good. Cranial nerve 5 is intact. I'll ask you to puff your cheeks. Alright, cranial nerve 7 is intact. Cool. Alright, now I have you shrug your shoulders. Yep, and move your head all around. Shoulder to shoulder. Cranial nerve 11 is intact. Good. Alright, go ahead and relax them. Alright, so next we will move on to his eyes. I was looking for my pencil, but won't need it right now. So with his eyes, I'll note that there is no discharge or redness or inflammation. Have them open up. Thank you. Thank you. Okay. So we'll know, have him open his eyes. His scleras are white. Look up. Conjunctiva are pink and moist. Alright. And then we'll look at his pupils and note that they are equal and round, and they are within the 40 millimeter size mark. So next we'll have him open his eyes, look at me. Alrighty. And then keep your eyes on the pen. Alright, so his pupils do pass the Perlis, or his eyes pass the Perlis test, which means his pupils are equal and round and reactive to light and as well as accommodation. Next, we'll check cranial nerves 3, 4, and 6 with the cardinal, 6 cardinal position gaze. Ready? Keep your eyes on the pen. Alright, cool. So cranial nerve 3, 4, and 6 are intact. Next, we'll move on to his ears and note that there is no redness or discharge or signs of inflammation on the outside of them. And next, we will check cranial nerve 8 with the whisper test. So you repeat what I say, okay?
Blue Crocs. Monkey bananas.
Alrighty, cranial nerve 8 is intact. So next we'll look at his nose and note that his nose is symmetrical. We'll have him tilt his head up, look within, and note that there is no deformities, asymmetry, drainage, or inflammation. Next we'll check and make sure that his nostrils are patent. So we'll cover one nostril, have him take a deep breath in. Again. Any trouble?
No.
All right. Nostrils are patent bilaterally. And next, we can check cranial nerve 1, which is olfactory, and we'll have them smell like an alcohol wipe.
Yeah.
Yeah, it smells like alcohol wipe. So cranial nerve 1 is intact, and next we will move on to his mouth. So we'll know that his lips are pink and moist. We'll have opened up. Tongue and gums are pink and moist. I'll have him say ah. Uvula and soft palate do lift. Next, I'll have you say light, tight, and dynamite.
Light, tight, dynamite.
Alrighty, so that means cranial nerves 9, 10, and 12 are intact, which we like. Alright, cool. So now that we're done with his mouth, we'll move on to respiratory. So I'll note that he has no accessory muscle movement. He's breathing normal. It's unlabored, so that's good. And now we'll auscultate his lung sounds with the diaphragm. Go ahead and step to the camera. Alright, got the diaphragm. Take a deep breath every time I land. Right upper lung. Left upper lung. Right middle lung. Left lower lung. Right lower lung. Left lower lung. Right lower lung. And left upper lung. Alright, no adventition sounds noted. He's just clear bilateral lung sounds. He switched now. This is the right, this is the left. Left upper lung. Right upper lung. Left lower lung. Right lower lung. Left lower lung. Right lower lung. Left lower lung. And right lower lung. Alright, go ahead and take a seat. Still the same, no adventition sounds noted, just clear lung sounds bilaterally. So now we'll check out his cardiovascular system. What we'll do first is check his carotid pulses, and we'll do those separately. So we'll feel. Cool, and they both are strong and 2+. And next we'll do his jugular vein. So we'll have it at a 45-degree angle, have him turn his head to the left, and look at the vein along his neck. If it were distended, then we have jugular vein distension, but it is not. It's flat, so that means it's normal. Next, we'll check for edema, because with right heart study failure, you can have edema. I'm not feeling any swelling, and he hasn't complained of any swelling. And we're really checking the lower extremities, because it can really go to the lower extremities, but I'm not seeing anything, so no edema noted. So next what we'll do is listen to his heart sounds. Listen to the diaphragm and with the bell. Alright, so I have to stand up again. Alright, aortic, pulmonic, Erb's point, tricuspid, mitral. Alright, S1 and S2 are noted. Alright, now we're with the bell side. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Alright, and no extra heart sounds or murmurs noted. There's just S1 and S2. Go ahead and take a seat again. Alrighty, and moving on down with the cardiovascular system, now we'll check bilaterally his radial pulses. Good. They're both strong and 2+. Now we'll do the dorsalis pedis, which is on top of his feet. They're both strong and 2+. And then I'll raise his ankle so you see we're going to move the posterior tibialis pulses within the ankles. And we're still doing them bilaterally. Strong and 2+. Alright, good. So his pulses are good. His cardiovascular system is done. So next we'll move on to looking at his abdomen. So I have him lay flat, and I will look at his symmetry and contour, looking from this angle and this one. And I will note that his symmetrical and as well as his contour is good. He's not protruding or anything like that. So that's good. While he's laying flat, what we'll do is also take his bowel sounds and as well as palpate. So we'll auscultate first in the order of the right lower quadrant, right upper, and then the left lower with the diaphragm side. So right lower quadrant, right upper, right lower, or sorry, left upper, and then left lower quadrant. Alrighty, and no abnormal bowel sounds. They all are normal bowel sounds. So next we will palpate in that same order. Our palpates be looking for distension as well as tenderness. Alright. So we'll start in the right lower quadrant. Feel anything?
No.
Alright. Right upper quadrant. Feel anything?
No.
Alright. Left upper. Anything?
No.
Okay. And then left lower.
No.
No?
No.
Alright, good. And I didn't feel any distension. He didn't have any tenderness, so we're good. Go ahead and sit up. Alright, so after we're done with his abdomen and his abdominal, next we'll move on to checking out upper extremities and lower extremities. So the ones I picked were the elbow, wrist, knees, and ankles. So I'll first look at all of them bilaterally, and we'll look at contour and symmetry. So with his elbows, I'll look. Alright, wrist. Alright, and then the knees, he could be lying flat, but I'm right here, so it's fine. And then ankles. Alright, and they all look equal and good, so we're good. Next we'll check the range of motion, so I have him just do what I do. So for the elbows, we'll flex them, extend, flex, extend, good. And then the wrist, flex, extend, around and around and around. Good, now have him lay down and do the legs, so you guys can see. Alright, so we'll have him flex, extend, flex, extend. Alright, now put your ankle towards you, towards me, around and around. Alrighty. Next leg. Flex, extend, flex, extend. Alright, foot towards me, foot towards you, round and around. Alright, full range of motion. Alright, so it's elbows, wrists, knees, and ankles do have full range of motion, so we can move on to his lower extremities to make sure he has sensory in his lower extremities. So I have him close his eyes. What did I do with my pencil? There's somewhere right here. It's okay. I could improvise. Go ahead and close your eyes. Tell me if it's dull or sharp.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp.
Alright, he does have lower extremity sensation. So next what we do is check his upper extremity strength and his lower extremity strength. So I have him do like this. Pull against me. Alright, go ahead and lay down. Pull your leg against me. Yep. Now stand on the side so you guys see this side. Pull your leg against me. Good job. Cool. Alright. Full muscle strength in the upper and lower extremities. So next what we'll do is we will assess his gait. His walking. That'll be the last thing. So go ahead and stand up. Stand from there. Yeah. And walk in a straight line. Why are you putting your head down? Walk in a straight line. Cool. Alright. No abnormalities. Go ahead and sit down. Alright, so that was the last thing that we needed to assess. His head to toe assessment was conclusive and as well as it went well. So what we'll do is thank our patient. Mm-hmm. Well, before we thank our patient, assess the pain. Mm-hmm. Alright, so on a pain scale, 0 being no pain, 10 being the worst pain of your life, what would you rate your pain?
0.
Good. We didn't hurt our patient. That's what I like to hear. Alright, now we thank our patient.
Mm-hmm.
Alright, thank you, Mr. Banks. I thank you guys for watching. I perform hand hygiene, and this video is over with.